physio today, so I just wanted to ask, what's your problem? Why did you come here? Or what's your injury?
Uh, yeah, I feel a stiffness on my neck and a bit of pain. After
Okay.
a few days ago, I was in a car crash.
In a car crash.
Yeah, I was just sitting in my car and someone just hit me from at the back of my car,
Okay.
and I just yeah
And there was just pain after that.
yeah.
Okay. Well, was there any radiating pain? Did it go down? Does it go down to past your elbow?
No, not really. No, I don't feel any pain on my arm. It's just
It's just your neck.
on the neck. Yeah,
Just on the neck. So,
yeah.
can you describe the pain?
Yeah, I'd say it's not sharp. It's really dull and it's all over the area.
All over the area.
Yeah.
And have you lost range of motion? For example, looking left and right, or yes or no?
I don't really know because I don't know the range of motion, but uh, I do feel pain when I'm.
So when you do look, it's a little bit painful.
Yeah, it is.
Okay,
It is.
understandable.
I
Okay,
feel like it's pulling my neck
okay,
when I'm rotating, for example,
yeah,
and yeah, it is causing me pain.
okay. So I just wanted to. So yeah, so I also just wanted to ask, what is your goal for coming here in the physio?
Just get rid of the pain.
Just get rid of the pain. Okay. And just another question: when did the car accident happen, and when did the pain start?
Around 3 weeks ago.
3 weeks ago. Okay, interesting. And then, so I'm just gonna ask you a couple of questions. These are questions we ask every patient just to know if I should be treating you, or if I should send you to a GP, for example. So you just yes or no questions, basically. So do you feel sick, lifeless, or exhausted?
No,
Okay, good to hear. Do you have trouble concentrating?
sometimes yeah.
Sometimes.
Yeah.
And when do you struggle concentrating?
I can't really define it, but when I'm working, for example, I sometimes just feel like foggy
Foggy.
head. Yeah.
Okay. Are you experiencing any headaches?
No, not at all.
Okay. Good to hear. So you did mention that you had an accident recently with a car.
Yeah.
Car.
Yeah.
Can you just dive deep into that? Explain to me what happened.
Uh, yeah, not much to say really. I was just sitting in my car and I was waiting to pick up my kids from school. And yeah, someone just came at the speed of 20, 30 kilometers and go to hit my car.
From the back.
Yeah, and I felt there was a snap on my neck.
The snap.
Yeah,
Okay.
like my head just
Like that, like
yeah. And after that point, yeah, just
It started hurting after that.
Yeah.
Okay. Did it swell up?
I didn't really notice any swelling to be honest, but I can't say for sure because I can't see it, but I didn't feel any swelling.
Was there any redness? No.
I can't tell, but no one reported from home. No one reported that it was red or something.
Okay. Good to hear. Okay. Have you had any recent surgery?
No,
No. Okay. Do you have a fever?
no,
Okay. Are you taking any medications?
no.
How's your appetite? How are you eating?
Yeah, same as always.
Same as.
Yeah.
Good to hear. Have you lost any weight recently in the past month? For example, more than
Not
5
really.
Okay.
No.
Good to hear. So I asked you to describe the pain. Obviously, you told me that it's a dull pain, right?
Yeah.
Like it's a dull pain, and then when you're just turning left and right,
Yeah.
doing work or daily activities, that's when it kind of hurts.
Yeah.
Okay. Can you influence it through exercise or moving more? When does it hurt most? Or when does it not hurt most?
Uh, yeah, usually when working at home, for example, and having to do just household things, I can really feel it gets more intense after a certain point. Like after the first 10 minutes, I can feel it tensing up and just the feeling of pulling.
Yeah.
And yeah, I usually just try to lay down and yeah, not exhaust my neck.
Okay, so you're saying that the pain's increasing then?
Yeah, yeah, it goes usually up. I can feel it just increase a lot.
Okay, so can you give me a scale for example, you're doing your daily activities through your normal daily life, and from that, when you're doing a lot of daily activities, chores at home or whatever, scale from 0 to 10, so 0 being doesn't hurt at all, and 10 being really painful. So,
Ah,
what's the peak during the day?
yeah, on rest I would say it's somewhere around 3
3. Okay, good to hear.
in best cases without any painkillers or anything, just rest.
Okay,
But when I start working at home, I can definitely feel it going up to 7.
up to 7.
Yeah,
Okay,
yeah, it's really painful.
so it goes up to 7. Okay, up to 7. And then, so I asked you already, do you have any radiating symptoms? You said no.
No, 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 not really.
Do you have loss of strength in your arms and legs?
I don't know. I wouldn't say l- strength loss, but I try to avoid lifting.
Lifting heavy stuff.
Yeah, yeah. Because I can feel that whenever I try to lift something, my neck instantly get tense.
Yeah,
But I
understandable,
don't think I don't feel any.
loss of strength.
Yeah,
Okay,
yeah.
good to hear. Have you ever had cancer, or do you have cancer?
No, no.
Okay. Are you confused or sometimes less conscious?
Other than when the foggy
Yeah.
and the cures, not really. Other than that, no.
Good to hear. Do you sleep well?
Yeah, I do face some issues, especially with my pillow, because at night when I try to lay down, there are cases when I just wake up because I can feel pain on my neck, but I just turn on the other side and I keep sleeping. But I wouldn't say I sleep really well.
Okay.
Yeah.
So can you influence it? So you said that you do turn.
Yeah.
Is there any position that helps you sleep the best? Can you influence it?
Not really. Everything is painful, but
painful.
when one side it gets tired, I just turn from the other side.
Okay.
But other than that, if I lay on my back, I can feel the pain because of the pressure that's been applied on my neck.
Yeah.
When I lay on the side, after a while, I can feel
It's paining that
yeah,
side, so you have to-
yeah, yeah, yeah.
Okay. Do you experience any night sweats or chills?
Can you repeat the question?
Do you experience any night sweats or chills?
Not really, no. Other than the pain at night, nothing else. No.
Okay. And then you said that you struggle to focus sometimes. It gets a little bit foggy. Do you
Yeah.
have any? I'm not sure if I asked you, but do you have any headaches or anything like that?
No, no.
No. Okay, that's good. Um. So, do you struggle holding in your pee or poo or facets or anything like that?
Not really, no.
No, that's good to hear. So, do you struggle with picking up anything?
No.
No. Okay, that's good to hear. So you also told me that it's not really radiating.
No, no.
Pain, so it's just up here on the neck.
Yeah.
Okay. Okay. Well, now we're just gonna talk more about the problem, the injury, and then just dive deeper into that stuff. So that's the screening.